anti-inflammatory effects. And that's a big point for us because most of the treatments for endometriosis are based on the use of progesterone-like hormones, the progestins. And some of these patients fail to respond to the treatment. And the reason for that is that because there is excessive inflammation in the endometrium. So for many years we made a big mistake. We used monotherapy to treat endometriosis, and that's not the case anymore. We have to combine different drugs in order to achieve success. So far, these are the endometrial changes that can be detected in patients with endometriosis. High inflammation, activation of aromatase, and consequently, they have a production of estrogens in the endometrium and also in the lesions. They have increased incidence of cyclooxygenase, which leads to higher production of prostaglandin, which explains excessive